My name is Ida Gutierrez. I'm a physical therapist, physical therapy director at Laredo Sports Medicine Clinic. I've been a therapist 27 years. Graduated from Texas Tech University with my master's in physical therapy. I did attend UTSA and Laredo Junior College at that point, or LC now. Early on, I have an aunt that has cerebral palsy, and when I was 14, I went to go spend a summer with her, a couple of weeks with her, and I was able, or fortunate enough to be with her when she underwent her physical therapy sessions. And I remember that look, that feeling that she came out with, that positive energy, and I remember telling myself I would love to have an impact in someone's life like that. Because she just came out with so much energy, feeling refreshed, more mobile, and I loved it. I fell in love with it immediately. Physical therapy can help with teaching a person about their body, being aware of your body in space, how to utilize your muscles and your body in a proper position to avoid repetitive use activities that will cause injury. Maintaining movement. Our main slogan is motion is lotion. That's for the American Physical Therapy Association. So maintaining movement will help to keep the joints lubricated. The flexibility will help keep the joints healthy, and strengthening to help support our structure. Now, we all have different roles in the physical therapy clinic. My role, for example, I primarily see the initial evaluations as the patients come in, set up their plan of care after they've been evaluated. You assess the program, the patient's ability, and then set up a plan. So typically that's like the start of care, and then I'll follow up with a progress report at the end of the plan and see how much progress the patient has made throughout the time in therapy. In between there, the patient undergoes treatments, and typically with my patients, I have physical therapy assistants that do such a fabulous job emphasizing following through with the plan and treating the patients. And we take them through till a discharge, till patient has met their max functional potential. Pretty much each patient will get their own customized plan based on their initial evaluation. We assess their diagnoses, we assess their limitations, their strengths, their weaknesses, and then from there be able to set up, okay, where are your strengths? We want to help balance it out with your weaknesses and make it for a good, balanced person. To be very honest, I really like to focus on the basics, making sure a patient has good core engagement, muscle engagement, and stability. Shoulder blade stabilization, make sure that the shoulder blade for upper extremity movement is the key to making good progress. Same as for the lower extremity, the glutes, the hips. We really want to have good stability so that the patient is able to maximize their progress, and so that's where my focus tends to be. Physical therapy is really important to follow through for long term because you're learning the body mechanics, you're learning your body in space, and you want to have that protection for your joints for longevity, to be there around for when we need it. That's a really good question. I've been a therapist 27 years. I've seen multiple wonderful cases. I think every case is special to me, especially when the patient makes progress. However, I do have one in mind that she was just a really difficult case because she ended up having both legs amputated due to a traumatic accident and seeing her progress in rehab throughout that time. This was my earlier years as a therapist, so it just really opened up my eyes to see, wow, you know, this woman just showed me so much by her overcoming all those diversities, overcoming the obstacles. She showed me a lot, and so that case really stands out in my mind. Being a therapist for 27 years, I've had a lot of challenges. The way to overcome them is just battling one at a time and moving forward from there. Most importantly, always make sure that you are assessed by a professional. If the injury continues for more than 3 days, as far as like the pain continues, the swelling, 2 to 3 days, make sure that you're assessed by a medical professional. And you'll always want to try to follow, if it's like a sprain, an initial kind of injury, follow the RICE method, which is an acronym that stands for rest, ice, compression, elevation of the joint. That's really important to follow. I think that's the key right there, just staying active, moving, trying to avoid staying in one place, staying in bed, sitting on the couch. You need to keep moving. Make it a challenge to go out, to get up, walk to the bathroom, take a step if needed to work the strength, just getting up and moving. Being in this profession already over 27 years, there have been so many changes. This has been just a gradual, progressive change, and so I still anticipate we have a lot coming for us. For example, when I got accepted into PT school, that was the first year they transitioned from the bachelor's program to the master's program, and that was already something that had been in the works for years. And so they were already at that point starting to talk about transitioning to the doctorate program, which has kicked in a few years ago. And I still feel like this is just a revolving discipline that has so much in store for us. The most important way to stay up to date is we do continuing education courses. So we can choose to take courses out of Laredo, online. There's just so many opportunities. Now we've just signed up to a program that will have easy access to learning, and we get new grads all the time, students. There's just so many opportunities for learning. I think the best thing is trying to volunteer at a location, at a clinic. Observe as much as you can. Learn as much as you can by being exposed to the discipline, to anyone. Talk to someone that is in the field and ask them questions as to anything that, is this something that interests you, the education that you need or the training that you need to accomplish your goals, and stay focused on what it is that you want to do. It's not easy, but nothing in life that is easy is worth doing. You can book a session with me, call Laredo Sports Medicine Clinic, and the wonderful staff will be able to get you scheduled in. We need a doctor's order, preferably, so that we have a diagnosis and be able to go from there for your evaluation.